Hello and welcome everyone. I think we're 22 now and there are people joining now, so we can start in a short while. So I want to make sure that the recording has started.
Yep, we've started recording.
Cool. Welcome everyone. Good afternoon or good morning, depending on where on earth you're joining us from. We're now in the MENA breakout session that will be held in English. If you want to go to the groups that will be in any other language, Arabic, French, or Spanish, please let us know now so that we will help you to move there. Now, without wasting much of your time, I and other moderator and co-facilitators will introduce ourselves. Meanwhile, we would kindly ask you to introduce yourselves in the chat box. You could tell your names, where you are joining from, your schools, the organizations that you're affiliated with, or any other information that you want to share with us. I would like to once more remind that all the program, including this breakout groups, is being recorded and will be published publicly later on. And I also want to remind that at the end of this breakout session, we'll have approximately 5 minutes to answer your questions. So if you have any questions, please don't hesitate to ask them to us in the end. So my name is Ömer Faruk Sönmez. I'm from Turkey. I'm currently based in Sofia, Bulgaria. I'm Executive Officer at European Dental Students Association, ATSA, and I am also a member for Youth Health Working Group in Civil Life Association, which has a consultancy to the status to the United Nations. I'm a youth health advocate working closely with young refugees. I'll be moderating today's MENA English discussion, breakout discussion, along with my young, dynamic colleague, Amit. Floor is yours, Amit.
Thank you so much, Omar. Hello, everyone. Nice to see you all. Nice to meet you. My name is Amit Timilsina. I'm currently Vice Chair at the Youth Coalition for Sexual and Reproductive Rights. I'm also a member for Asia Pacific Alliance for Sexual and Reproductive Rights. And currently, I'm also a member of Evidence and Knowledge Working Group, the PMNC at WHO.
Thank you, Amit. So we would like to begin our conversation by asking you some questions. But before, maybe our co-facilitators would like to introduce themselves as well. We have Katie and Sima helping out today. Hello.
Hi, so excited to be joining you all today. My name is Katie Meyer, and I'm with the Interagency Working Group on Reproductive Health and Crisis. Thanks, Omar and Amit, for having us.
Welcome. And Sima.
Hi everyone. Hi everyone, my name is Seema Manohar. I've worked with the ASRH Toolkit since 2011, so I'm really happy to see the journey of this toolkit. The latest version is a super great resource, so I hope you all find it interesting and useful. Thanks. Back to you, Omar.
Thank you, Sima. And I'm seeing that in the chat box there, we have a diverse group from especially MENA region, and we have many specialists, many youths as well. So I'm really excited to be holding this breakout session with this participant profile. Thank you for joining. We have some questions for you to begin the discussions. And the first question I would like to ask is, what do you think are the issues facing adolescents and youth in humanitarian settings regarding their sexual and reproductive health? You can either answer the questions by speaking loud or writing them in the chat box. Our co-facilitator Sima will read them out at the end. What you've written in the chat box. So does anyone does anybody want to provide input for my question? If you want, I can repeat it again. Well, Amit, actually, I wonder your input regarding this. Firstly, would you like to share your experiences regarding the issues facing adolescents in humanitarian settings?
Omar, thank you so much. I think it is a very important question. And from my experience working with adolescent and youth, especially in humanitarian setting, I feel that most often the SRH need of sexual and reproductive health need of adolescent and young people are neglected at times, and mostly, especially during the humanitarian setting. And we also learned during the poll as well, like there are lots of issues that concerns adolescents and youth in humanitarian setting, and one of them is definitely the disruption of their education and health services. So they are barred from those accessibility of health services, and also like they are also very much vulnerable to increased risk of sexual violence and abuse. So I think these are some of the issues that I list down here, but looking at our like participant, I think we are going to hear better experience from the participants as well.
Yeah, thank you for your intervention, Amit. That was wonderful. And actually, I would like to share some things as well. To speak with my own experiences, it's likely that youth and adolescents face a lot of problems regarding their sexual and reproductive health, especially in humanitarian settings. As I told, I live in Turkey, close to the Syrian border, and working with young Syrian refugees in my organization. Therefore, I witnessed issues such as sexual violence, increased transmission of HIV and other sexually transmitted infections, no health services available, unintended pregnancies, increased number of morbidity and mortality, both in general population and among maternal and newborns. And I witnessed a lot of cultural stigmas and taboos around sexual reproductive health. So I think we have a lot of input in the chat box. I would like Sima to read them out, actually.
Sure.
Over to you, Sima.
Yes, a lot of good responses. I'm just going to choose a few. We have Bana, who said inaccessible services and safety of reaching them. Iktihar said lack of information and services on menstrual hygiene and family planning. We have disrupted social networks and support mechanisms. Adolescents remain a neglected group with high risk of GBV. Yeah, so these are some of the responses what we've got from no dignity kits for girls is another one, and they keep coming in. Okay, the last one is from Shai, who says sexual abuse, teenage pregnancy, and Tosin says no safe space environment for adolescents.
Wow, we have a lot of marvelous interventions to this question. And if anyone wants to speak more about it, please go ahead. You can
hi.
turn. Yeah, hi.
My name is Jennifer. I'm from Palestine. I work for a Palestinian NGO. It's called Jazur for Health and Social Development. Adolescents in Palestine are suffering from a lot of issues. As you were saying, we have occupation, so that's one thing that does not help in access to health services. We also have early marriage. We have a high percentage of early marriage. We have a problem with knowledge and educations where it is still taboo and stigma to talk about our sexual reproductive health and rights. So I think that's part of, we don't have enough protection services or access to other social services as well.
Yeah, any other participants who wants to add?
May I? Can you hear me?
Yeah, sure, go ahead.
Yes, I am also working in UNICEF Turkey as a field education assistant. I think first of all, they don't have access to any other services, not only in terms of health and let's say education, but first of all, the protection for especially young refugees, it's really not sufficient. And also education, health, it's another big issue for them. And when we talk about the sexual abuse and many other services, actually I can say that that's also other issues that they are living. And of course, first of all, mental health is also the biggest issue beyond all of it.
Thank you.
Thank you so much. And Omar, like you also shared your experience with us regarding the issue, and also like it's so nice that we are here. We have like toolkit, SRX toolkit, and we are at the global launch. But how do you think you will be able to use this toolkit back into your work or into your country? How are you planning to use it?
This is a very important question in terms of practical usage of the toolkit. I would shortly answer this question and then maybe move to the chapter 4, because we have almost used 10 minutes. Actually, the target group of my organization mostly consists of youth and adolescents, refugees. Therefore, it's described more as an humanitarian emergency rather than a standard humanitarian setting. So adolescent sexual reproductive health plays a critical role when it comes to the emergencies. And I believe this toolkit is a great way to prioritize sexual reproductive health in my organization and use adolescent inclusive methods and adolescent friendly methods in our humanitarian response to the emergencies. I think toolkit will also be very useful in terms of establishing community engagement with different stakeholders, such as the community health workers or civil society actors. So I think in this way, actually, we can have the other answers in the chat box, as you just said, Amit, and we can slowly move to, meanwhile, we can slowly move to the chapter 4 now. So we'll be talking about the chapter 4 and 5 in this breakout session. I'll be doing the chapter 4 in it, and then my colleague Amit will do the chapter 5. Chapter 4 is priority adolescent sexual and reproductive health activities in emergency settings. So it is very linked with adolescent inclusive minimal initial service package, with its abbreviation MISP or MISP. So you'll be hearing this a lot. You better get used to it, MISP. Chapter 4 provides guidance on how to implement MISP, and MISP outlines the sexual and reproductive health service activities that humanitarians should prioritize in emergency settings to address adolescents' unique needs. One important point is that these activities in terms of MISP objectives should be implemented from the onset of an emergency through to the recovery phase. So I would like to ask a question here and learn if you know any of the 6 life-saving objectives of MISP. If you do know any, please write them in the chat box or just say it loud. The 6 objectives of minimal initial service package, MISP. Does anybody have an input for this question? Aliu Maga said response to CMR. Yes, that's one, actually. Yeah, well, MISP actually is consists of actually 6 life-saving objectives, as I told you. I would like to tell them what those objectives are. First objective is ensuring the health sector or health cluster, identifying an organization to lead implementation of the MISP. And the second objective is preventing sexual violence and responding to the needs of sexual violence survivors. The third is preventing the transmission of and reducing the morbidity and the mortality due to HIV and other sexually transmitted infections. The fourth objective is preventing excess maternal and newborn morbidity and mortality. And fifth one is preventing the unintended pregnancies. The sixth one is planning for a comprehensive ASRH services integrated to the primary healthcare as soon as possible. So yes, these were the 6 objectives of MISP, and we believe that when implemented from the onset of a crisis, minimal initial service package is saving lives and preventing illnesses, especially among women and girls. Yes. And I would like to also share that MISP ensures that during emergencies, we provide adolescent-friendly services. And MISP has tailored activities specific to the sexual reproductive health needs of adolescents, beginning in this chapter 4 and expanding through the rest of the toolkit. Yep, so that's the difference between this chapter and the other chapters of the toolkit. And I would like to, in terms of MISP and chapter 4, I would like to learn your input and your intervention about why do you think chapter 4 is important in humanitarian emergencies. Please don't hesitate to write your inputs in the chat box, and we'll see what makes chapter 4 important. Or anyone who would like to say it loud, more than welcome. Yeah, we have Ganesh Ambika, and he says, you want to speak loud? Please go ahead.
Yes, this is Aliu. I think chapter 4 is really very important, as it really gives opportunity to adapt, the usual misinterventions with to adapt them in a way that adolescent girls are not really excluded. So I think this is one of the most important learning that I'm getting from this adolescent toolkit. I think from now on, whenever this toolkit is being implemented, we'll be able to coordinate with any other sexual reproductive health interventions to make sure that we take into consideration the needs of adolescent girls.
Yeah. Exactly. So yeah, thank you for your intervention. That's actually what the chapter 4 is about. And we have Ganesh Ambika from India, and saying this is a very important information for my students and my organization, organizing training programs for youth. Yes, exactly. Education, actually, sexual reproductive health education is very one of the one of the biggest competent of the toolkit as well. And we have Shai from Philippines. Adolescents, boys and girls are also vulnerable in times of emergencies. Exactly. And we have Tosin Plan from UK saying this depends on the intervention. This will be very important for the intervention for adolescents, girls and boys. Exactly. Thank you for your amazing amazing inputs. So I talked about the cluster approach and the saying the first objective of MISP. I would like to dig it more, and I would like to ask if you have heard cluster approach before. So do you know what cluster approach is, or just make a guess, make a prediction, just type them in the chat box or just say it. What can cluster approach be about?
Hello.
Hello. I think Alu again. Yes. Over to you, Alu.
Yeah, so the cluster approach is a coordinated and collaborative way of humanitarian assistance, which is organized by, if you want, by sector of interventions, including health with its working group like sexual reproductive health, for instance, protection clusters, food security clusters, nutrition clusters. So it's really a coordinated way to provide a full package of humanitarian needs, able to respond to the various needs of the affected population.
Yes, exactly. It's very great to see that you have so much information about the toolkit, Alu. Thank you. As you just said, as just Elio said, the health sector must work with the other sectors to ensure crisis-affected populations receive the sexual reproductive health information and services that they need. The aim of the cluster approach is to strengthen system-wide preparedness and technical capacity to respond to the humanitarian emergencies. And also it provides clear leadership and accountability in the main areas of humanitarian response. At country level, it aims to strengthen partnerships and predictability and accountability of international humanitarian action by improving prioritization and clearly defining the roles and responsibilities of humanitarian organizations within the host country. So we can basically say in the cluster approach, all the stakeholders such as government, United Nations agencies, civil society actors, non-governmental organizations work in harmony with distributing the roles and the tasks. For example, early recovery is provided by the UNDP, health is provided from the WHO, and education from UNICEF. So UNHCR ensures protection, FAO for food security, and so on. I mean, these entities with local actors are essential partners for ensuring response interventions to an emergency. Yeah, so I think it's good for chapter 4 now, and I will let Amit go ahead now. So you'll be having more information on the chapter 5 as well. Over to you, Amit. Thank you for listening and all your inputs, all your amazing inputs in the chat box.
Hi, thank you so much. I hope you can hear me. And like we definitely understood about like why prioritizing ASR in emergencies situation is important, and why like effective coordination is important to address the unique situation of adolescent sexual and reproductive health during the humanitarian crisis. But the chapter 5 brings you like very good thought, a very good description of why we need to go beyond health services. And like we already discussed, how intersectional the it is important, why it is important to have like very intersectional approach to address adolescent sexual and reproductive health needs, particularly during the humanitarian crisis situation by the practitioner. So like focusing only on health services will not be enough to address the unique SRHR need of adolescent. So like this chapter proposes you with the very innovative concept of how we can be holistic in our approach, and helps us to like know like how various issues can help in intervention as well. So this particular chapter proposes that the holistic lens is not like just identifying and identified by the health staff, but it also depends on various environmental factors. Like the chapter itself shows how interpersonal issues and also like at the individual level or like the community level or even the structural level can influence the unique need of SRHR and how that can be seen as a holistic approach. So if you have like read or if you go through the chapter, you will definitely understand that. And apart from that, it also provide very good emphasis on multi-sectoral approach. And it says that by strengthening the program linkages or like through the referral pathways or the coordination mechanism, sexual and reproductive health and particularly health manager can address the full range of barriers affecting the information and service provision for the adolescent. So this is how like this can help you as a program manager or like health manager or like community leader to address the unique needs of ASRHR during the humanitarian crisis. So not only this, like if we have multi-sectoral approach, like one of our participants rightly mentioned about the coordination between the various clusters, it will help us to like avoid duplication in our efforts and also like prevent the gap that we now have in service delivery, and also help adolescent develop resilience and help to identify agencies, especially among like hard to reach adolescents. So I think this toolkit provides a very unique perspective to like why we have to go beyond the health services. And one of the main feature of this chapter is also that it provides you with figure which explains how interpersonal relationship, community, health service and system, humanitarian coordination and leadership, and economic, political, and security environment, how they are part of like the social ecological model and how they can be very helpful to address the ASRHR ASRH programming in the humanitarian setting. And not only this, at the end of this chapter, you will also get to know the factors of the social ecological model that either like enable or restrict access to SRHR information and service, particularly for the adolescent, and also provides you various guidance on how we can respond to those challenges so that we can mitigate the risk, overcome the barrier, and improve the access to sexual and reproductive health information for adolescents and young people. So this is it from the synopsis of the chapter 5, going beyond the health service. But I have one important question to ask, like how do you think what could be the best part of this chapter? Like how can you use this in your work, or like what according to you is the good thing about chapter 5? Please write it down in your comment box, in your chat box. What was the highlight for you from this chapter, going beyond the health service? What did you find very useful? I can see that Shai mentioned that we can lobby policy to strengthen our ASRHR need in the humanitarian crisis situations. The social norms and structure, very rightly said. We can also we definitely have to take the social norms and structure while we design our programs, and also like important aspect of going beyond the health service. We also, one of our participants also says that an integrated approach is the way for radical and sustainable change, addressing underlying issues beyond the health problems that they face. And Sai again says that to strengthen social behavior change and communications is very important. And I also suggest you to look at the individual, interpersonal, community, and structural portion in the chapter specifically. I think that will be very helpful while you design and deliver the programmatic interventions. Anything you want to say, like if you want to add or anything you want to say regarding this, why we need to go beyond health service, why according to you, you think we need to go beyond the health service? Anything, anyone wants to speak up, like why we need to go beyond the health services? Katie, would you like to respond to the question, like why it is important for us to go beyond the health services?
Sure. So I think that it is easy when each of us are specialists to stay in our field and only see the services that we work on every day. But adolescents and young people touch all of the services in humanitarian settings. And so we need to be as creative as you are, as Amit and Omar, in thinking about how we can reach adolescents and young people, because like so many people said in the chat box, they are often neglected. So we need to be thinking about other ways to reach them. And I think you mentioned a few of them, Amit, but in the toolkit, we talk about how you could potentially have some SRH information on the back of a latrine. Like you can think about how to put SRH information and services in other areas beyond the health facilities.
Yeah, thank you so much. Anyone wants to provide the input in the chat? You can also provide your input in the chat, like why is it important to go beyond health service working at your community, particularly to address SRH need of adolescents?
Yeah, this is Ganesh. Can I add some points there?
Yeah, please go ahead. Yeah, please go ahead.
Yeah, this is Ganesh from Nepal, especially addressing the needs of adolescents, particularly to those who are out of school and who are on risk of different vulnerable issues. We need to consider that they must have access to other formal or informal education opportunities, reintegration in schools, or learning opportunities in different platforms to make their transition to adulthood easier, and also to link with the other opportunities like livelihood opportunities or other skills that they need to sustain in their future life, as most of the adolescents who are out of school or who are poor and from marginalized communities who do not have other access, they are more they might be in more risks, So considering that scenario, we need to have different approaches to reach them with the information and with the services that they actually need. So we need to have a mapping and addressing those issues of adolescents who are in risk. So it's very important to address from other sectors beyond health as well.
Thank you so much for your input. And also one of our participant responds that because SRH needs go beyond health, it's also interconnected to economic, poverty, education, and protection. Thank you so much for your input. So I think we are like we have very good discussed about chapter 4 and 5, and if there are any questions that you want to ask us, or if there is anything that you want to bring on, so please go ahead. Either you can do it in chat, or like you can also speak out here as well. So please go ahead.
Can I talk, Amit, please?
Yeah, please go ahead.
Okay, thank you. Actually, we have a term in the chapter 5, and this term is very important in terms of addressing the needs of adolescents as a whole person, not only in terms of sexual reproductive health, but as a whole person. So I would like to emphasize that holistic lens, the term holistic lens means that humanitarian practitioners are also taking notice of the other factors that impact adolescents' ability to get the services and information that they need. And not just at a health facility or health education, but in their environment, which can be like anything. So to understand what the factors are, sexual reproductive health managers or workers need to talk to adolescents themselves, not just not just maybe themselves, but also their family and community members, and maybe service providers like community health workers. So by collecting and talking with all these partners that I said before, with these conversations, will reveal obstacles that health and sexual reproductive health managers can overcome with the sexual reproductive health programming and planning. So that will require a multi-sectoral engagement. I hope I'm clear with what I wanted to tell.
Yeah,
so
definitely.
Do you want to add anything?
And Omar.
Yep.
Sorry, Omar. Just to add on to what you've just pointed out about having conversations with adolescents themselves, it is really important. You know, the community or policies might recognize that everything is interlinked. We may recognize as, as aid workers or NGOs, everything is interlinked, but that might not be the case for the gatekeepers. So gatekeepers such as parents, religious leaders, teachers, they may not see the interlinkages. So these communications, this participation is really important early on in the process as a first step to making sure that programming is more holistic.
Yeah.
Yes, exactly. Thank you, Seema.
Yeah, and also this chapter also specifically like stresses on how like it is important that the SRH managers who are working in this sector needs to talk to adolescents themselves, as well as their family and community members, service providers, community health workers, and also like humanitarian responders working in this sector. Thus, like I think one of the very beautiful thing about this chapter is the concept of holistic lens. Why there is need of holistic lens, and how the holistic lens can help to address these unique challenges that adolescents face during the humanitarian crisis. So yeah, like we discussed, it is important to see the adolescent health, and especially like the SRH need of adolescent from the holistic lens. And this also requires multi-sectoral coordination. Yeah, very rightly said. And also like one of our there is also like one of the comments which says that the economic, and also like I just missed out the response, but the gender inequality beyond the above mentioned in terms of what we mentioned until now. So like they have also brought the discussion of gender equality in this one. I think this is very a nice comment from one of our respondents as well. Anything anyone wants to ask question or wants to add up in this discussion? Yeah, so I'd like to, I think we only have a minute before we return back to the main sessions. So I would like to sum up our discussion. We started very well with like how, what are the needs of like SRH needs of young people, especially during the humanitarian crisis. And during our chat discussion or like the discussions, we highlighted that inaccessible services and safety of reaching like safety issues, and also like the problem of reaching out adolescent, the issues of family planning, menstrual hygiene, sanitary products, increased violence, and the limited safe space for adolescent and teenage pregnancy as highlighted issues that adolescents face, and also like how this toolkit can be used in your part of the world. And we discussed that the toolkit will be very useful to design projects to work for adolescent and youth in humanitarian setting, and also to inform the community people regarding this. And also, we also discussed about like how in the chapter 4, like we also discussed about how we can prioritize ASRHR in emergencies activities, and we also discussed how adolescent boys and girls are vulnerable and how prioritization is important for programmatic intervention. Similarly, in the chapter 5, we discussed how going beyond health services is important, and why like we need to go beyond the health services because it's an intersectional issue, and we need multi-sectoral collaboration and the concept of holistic lens to address the situation. So thank you so much for your participation, everyone. It was very good discussion and very nice to meet you. Now we'll head back to the main session. Thank you so much for your participation.
Thank you for your this fruitful discussion.